So would you like me to show you how it works, Boo?
That'd be great.
I think we've got a willing volunteer. Hi Nikki.
Hello.
Nice to meet you.
And you.
Thanks a lot for coming. So the idea is we're going to do a little role play of filling in this questionnaire called MYMOP. And the scenario is that we've already been together, you've been talking to me about your problems. I'm meant to be an acupuncture practitioner. So we'll have already had quite a lot of talking going on. We now got to the stage of the consultation just before we start the acupuncture treatment. And I'm going to try and persuade you to fill this in at that stage. That's okay?
That's fine.
So in a minute we'll go ahead and do some acupuncture, try and help you, but I wonder first whether we might just fill in this brief questionnaire, which is a little tool we're going to use for keeping a record of your progress and seeing how you're getting on. Would that be all right?
Yep, if we have to.
Not keen on questionnaires? No. So this is called MYMOP, and that means Measure Yourself Medical Outcome Profile. And the idea is it allows the patient, you, to decide what your main problem is and then to tell us how you're getting on with it. So which of those would you say would be the main problem to you today?
Back pain, definitely.
Yeah, okay. So let's write that. How would you describe that? Pain in the lower back or?
Yeah, right across the bottom of my back.
Okay, so we'll put pain across bottom of the back. And then the second one here, what do you think we should put there? What else has been bothering you?
Well, obviously the leg, the pain going down my leg, but I've got the asthma as well.
Yeah. Yeah, they both bother you quite a bit.
Yeah.
Well, on this form we're meant to have all of these connected to one problem. So do you think your leg pain is connected to your back pain? Does it seem to be all part of the same thing?
Yeah, they're definitely linked, yeah.
In that case, we probably ought to put the leg pain down. Okay. Hopefully your asthma will improve, but we won't be able to measure it on this form. Okay, great. And then lastly, one thing that these things prevent you from doing, sort of everyday thing that you like to do and you can't do very well at the moment.
It feels like most things, really. Just walking.
Yeah, it's annoying when you can't walk.
Yeah, at the moment I can't even walk to the shops, just the local shops where I normally go.
Okay, well we could write down, if that's all right then, walking to the local shops. Yeah, walking to the shops, yeah. Okay, good. Now it's your turn to take the pen, and we need to ask you to score this according to how bad it's been over the last week. Right at this end is very good, and right at this end is as bad as it can be.
Right.
So first of all, for the pain across the bottom of the back.
I guess I'm somewhere between a 4 and a 5.
I'm afraid you have to choose one of those.
Right. I guess it has been pretty bad, so I'm going to go with a 5.
Good. And then the pain down your right leg?
I'll put that as a 4. Yeah.
Good. And walking to the shops?
Well, I can't really. So I guess that's a 5 as well.
Okay. And then the last one is your general feeling of well-being, how you've been in yourself. And again, that's as bad as it can be, and that's as good as it can be.
Well, not great really. Probably a 5 again.
Great. And then how long you've had the problem?
It's probably just over 3 months. Yeah.
So maybe circle that one there then.
Sure.
3 months to 1 year. And then there's a question about tablets. Are you taking any medication?
Because I'm pregnant, I can't have anything other than paracetamol. So.
Do you take them sometimes for it?
If it's really bad,
Shall
yeah.
I write
then.
that one in then? So yes, paracetamol. So on average, if you were thinking about, a number of days a week, say, how many on average?
Well, maybe 4.
Yeah. Quite difficult, isn't it, if it varies?
It is.
So we'll put average to show that varies, yeah. And does that bother you, taking medication? Would cutting down medication be important to you?
Yeah, it would.
So you could say it's not important, a bit important, very important, or not applicable.
I think more because I'm pregnant, I would say it's very important.
Okay. Good, that's great. Thanks, Nikki. Now, unfortunately, it doesn't always go quite that smoothly.
Right.
So the idea is now that we'll rerun that, but some of the things that we do in filling in the form won't be as good as they should be.
Right.
So
Shall I go for
let's give that a try.
Shall I get a costume change?
Oh, very good. Yeah.
Okay. Totally different person.
All right, okay, you're in a different mood. Well, I'll take my scarf off. Okay, well, thanks, and that's been very useful talking to you. I wonder if we could just quickly fill in this health questionnaire before we go any further. It will help maybe certain what the main problem is that you've come along with today.
Can't we just get on with the acupuncture now? Done a lot of talking.
Yeah, I appreciate that, and I'm sure you're uncomfortable. It will just really take a couple of minutes, and I think we will find it helpful for monitoring your progress as time goes on. So perhaps, if you're okay, we just do it really quickly. And so we need to write, first of all, down the first symptom that's been worst for you.
All the pain in my back and my leg.
Yeah. So perhaps we'll put pain in the back and leg there then, shall we? There's a second symptom, something else that's bothering you. Perhaps we should put in where you've not been sleeping well, or your asthma. Perhaps put the asthma in.
Yep.
So something that you normally do that you can't do because of the problem that you've got.
That's walking.
Yeah. Okay, we'll put walking. Which number would you like to choose?
Oh, I don't know. Well, it's really bad, isn't it?
So be somewhere up this end then.
Well, it's probably normally a 5, but sometimes it's a 4, so maybe...
Can you choose between those two?
It's in the middle of those, really.
All right, we'll do 4 and 5 then. And the walking? Good as it could be, as bad as it could be?
Well, it's a 5, I think.
Okay. And what are you taking for that, did you say?
Just paracetamol.
And how many of those would you take?
Well, it depends, really.
How many each day?
Some days I don't have any, and some days I'll have 8.
What about yesterday? How many did you take yesterday?
Don't know, 4, I think.
Okay. That's fine. Thanks a lot. Sorry to take that time up. Okay, thanks a lot. That's great.
No problems.
It's really difficult doing that badly.